Okay, considering Mr. and Mrs. Stoic, we want you to imagine that you are an immigrant about to integrate into another country. What services do you need or you think you should have access to? So we looked at Canada and Norway's health system structure, their policies, government, and NGO support for immigrants. We found that both Norway and Canada had focused on universal and accessibility in their countries. So, considering Mr. Stoic had so many health conditions, he would have needed quick access to a physician when he came to a new country. In Norway, physicians, general practitioners, are given to the immigrant right away, whereas in BC, Quebec, and Ontario, you're subject to a 3-month wait period before you have access to the health insurance.
Mr. and Mrs. Stoic do not engage in many programs offered in their communities, mainly due to language barriers. Fortunately, the Canadian government funds local organizations such as the London Intercommunity Health Centre, which runs programs for senior immigrants that are culturally sensitive and run in different languages. The volunteers there can assess the senior immigrants' unique needs and create care plans for them and directly connect them with other public services in the community. In Norway, the federal government has a more direct role in immigration through the Directorate of Integration and Diversity. But the large role of the government in this way could really impact the social cohesion between the immigrants and reduce interactions between immigrants and their new community.
Based on our research and what is shown in our infographic, we've come to the following conclusions. So Norway allows faster access to healthcare because they immediately assign general practitioners to newcomers. On the other hand, Canada has a lot of community-based programs, but they lack in the immediate provision of health services for immigrants. These findings show us that Norway could work on improving community involvement to enable more social cohesion, whereas Canada could remove more administrative barriers. But despite these differences, the Migrant Integration Policy Index, a study done in 2015, showed that Norway actually ranked 4th, whereas Canada only ranked 18th in the health category. And this assessment was based on several measures, such as responsiveness to health services and policies to achieve change. So maybe Norway's government-heavy approach to the integration of elderly immigrants into the healthcare system may prove to be more effective, and Canada could benefit from adopting their strategy.
So based on the scenario that we presented to you in the beginning, start to think about whether Canada and Norway met your expectations for the health services that you imagined would be available to new immigrants. If you were Mr. and Mrs. Stoic, what resources would be helpful in helping you manage your health? And moving forward, we can start to think about how government bodies and NGOs can work to make immigrant integration an even smoother process. Thank you.